So in this case, we have a 14-year-old girl presenting with painless jaundice. That immediately tells us there's some underlying obstruction within the biliary system. Our first imaging modality is an ultrasound of the abdomen. And here we see that the common bile duct is dilated to 13 millimeters, far beyond what we would expect in a pediatric patient, where the normal range is around 6 millimeters. This degree of dilation clearly indicates a downstream obstruction. Next, we proceed with magnetic resonance cholangiopancreatography and MRI of the abdomen, which give us much more detail. We see that there's significant dilation of both the intrahepatic and extrahepatic bile ducts, but as we trace the ducts down, they taper towards the head of the pancreas. This is a classic indication of a mass obstructing the flow of bile at the level of the pancreatic head. Additionally, the pancreatic duct is not dilated, which might indicate that the mass is only affecting the bile duct without impacting the pancreatic duct itself. We then encounter a second finding, an abnormal mass in the lower lobe of the right lung, which is confirmed with further imaging. A computed tomography scan shows this large soft tissue mass in the lower lobe of the lung, as well as the mass obstructing the head of the pancreas. The combination of these two findings leads us to a very specific set of differential diagnoses. Now, we begin thinking about what could explain both the pancreatic and pulmonary masses in a pediatric patient. One possibility is that we are dealing with two primary malignancies, but that would be extremely rare. More commonly, we would suspect a primary tumor in one site that has metastasized to the other. The differential diagnosis for this presentation includes a primary pancreatic tumor. This is rare in children, but usually malignant. Neuroendocrine tumors and solid pseudopapillary tumors could both present like this, although the lung mass raises more concern for metastatic disease. A primary lung tumor. This is also rare in pediatric patients, but certain malignancies, like bronchial adenomas or sarcomas, can occur in this population. Lymphoma. Lymphoma can present with extranodal involvement and could explain the masses in both the pancreas and lung. A sarcoma from the Ewing's family. This is particularly relevant in pediatric cases. Primitive neuroectodermal tumors, a subset of the Ewing sarcoma family, can present in soft tissues and can metastasize to the lungs. At this point, the only way to definitively diagnose the nature of these masses is through a biopsy. A biopsy of the pancreatic mass confirms a primitive neuroectodermal tumor, also known as a PNET, which is part of the Ewing sarcoma family. This is a critical finding because it shifts our entire approach. Ewing's sarcoma and related tumors are aggressive, small, round blue cell tumors that primarily affect children and adolescents. They often present with metastasis at the time of diagnosis, which explains the findings in both the pancreas and lung. These tumors can be highly aggressive and require immediate, multidisciplinary management. The next steps in managing this patient involve surgery to remove the tumor, followed by chemoradiotherapy to address any remaining disease. In this particular case, the patient underwent surgical resection of the pancreatic mass, and she was subsequently referred to a pediatric oncology center for further treatment. Let's talk a bit more about primitive neuroectodermal tumors. They are part of a broader group of tumors known as the Ewing's sarcoma family, which also includes tumors like Askine tumors that occur in the chest wall and neuroepithelioma. While these tumors typically affect the bones, they can also present in soft tissues, as we see in this case with involvement of the pancreas. One critical aspect of managing Ewing sarcoma is the role of imaging in both the initial diagnosis and ongoing follow-up. After surgery and treatment, we use imaging techniques like computed tomography and magnetic resonance imaging to monitor for any signs of recurrence or metastasis. Metastatic disease, especially to the lungs, is the most important prognostic factor. Patients with only lung metastases tend to have a better prognosis compared to those with widespread disease. Ultimately, this case highlights the importance of considering rare malignancies in pediatric patients when we encounter unexpected findings, like masses in multiple locations. Primitive neuroectodermal tumors are aggressive but treatable, especially with early intervention and coordinated care. And that wraps up our case today. Remember, in radiology, the details matter. Always trace the findings back to their origin and follow through with the necessary investigations to confirm the diagnosis. Thanks for joining me on another episode of Radiology Made Easy. If you want more cases broken down in a simple and engaging way, don't forget to follow and subscribe. See you in the next episode.